Hi, good morning, Haley. Let's start the warm-up sessions.
All right, Mihiraa.
What is the purpose of the OET?
The OET is an English language test that assesses the language proficiency of healthcare professionals who want to work or study in an English-speaking environment. The OET covers the four language skills of listening, reading, writing, and speaking, with an emphasis on communication in healthcare settings.
Why did you choose nursing as a career?
I chose nursing as a career because I have always been passionate about helping people and making a positive difference in their lives. I enjoy the challenges and rewards of nursing, such as providing quality care, collaborating with other healthcare professionals, and learning new skills. I also find nursing to be a fulfilling and meaningful profession that aligns with my values and goals.
What are your strengths and weaknesses as a nurse?
Some of my strengths as a nurse are my communication skills, my critical thinking skills, and my compassion. I can communicate effectively with patients, families, and colleagues, using clear, respectful, and empathetic language. Moreover, I can empathize with patients and their situations and provide them with emotional support and comfort. Some of my weaknesses as a nurse are my delegation skills and my stress management skills. I also find it hard to delegate tasks to others when I feel that I can do them better or faster myself.
How do you handle conflict or difficult situations in the workplace?
When I encounter conflict or difficult situations in the workplace, I try to handle them professionally and respectfully. I follow these steps. First, I listen actively and attentively to the other person's perspective without interrupting or judging them. Second, I express my perspective and factual information without blaming or criticizing them. Third, I acknowledge any common ground or shared interest that we have and try to find a solution that is acceptable and beneficial for both parties. Fourth, I thank the other person for their cooperation and feedback and follow up on the agreed actions or outcomes.
How do you ensure patient safety and quality care?
Patient safety and quality care are my top priorities as a nurse. To ensure this, I follow these practices. First, I adhere to the standards of practice and code of ethics of the nursing profession. Second, I follow the policies and procedures of the healthcare organization. Third, I use evidence-based practice and best practices to guide my clinical decisions and interventions. Fourth, I document accurately and thoroughly all aspects of patient care in the electronic health record. Fifth, I communicate clearly and promptly with patients, families, and other healthcare providers about patient conditions, care plans, progress, and outcomes. Sixth, I participate in continuous education and training to update my knowledge and skills.
Your preparation time is up. Please start your role play.
Good morning. Please, come in and have a seat. My name is Haley Patterson, and I am one of the triage nurses on duty today. I can see that you both look quite distressed, but please know you are in a safe place. To begin our assessment, could you please tell me your name and the reason you have brought your son to the emergency department today?
Hello, Haley. My name is Mihiraa. I brought my 5-year-old son, Rooney, because he fell off his bicycle just a short while ago and hurt his shoulder. He has been crying nonstop, and I am really worried about him.
I am so sorry to hear that, Mihiraa, and I completely understand how overwhelming it is to see your child in distress like this. To help us evaluate his condition accurately, I would like to explore the details of the accident and his current physical symptoms. Could you please describe how the fall happened, roughly what time it occurred, whether he was wearing a helmet, and what specific symptoms or pain he is experiencing with his shoulder?
It happened about 30 minutes ago right in front of our house. He was riding down the driveway, lost his balance, and landed heavily on his side. Fortunately, he was wearing his helmet, so his head didn't hit the ground. He is holding his right shoulder, crying continuously, and saying it hurts whenever he tries to move his arm. I also noticed some swelling around his collarbone.
Thank you for providing those details, Mihiraa, and it is a huge relief that he was wearing a helmet to protect his head during the fall. I can hear the worry in your voice, but I want to offer you some strong reassurance regarding Rooney's condition. Rooney is currently stable with no life-threatening injuries, and his crying is a completely normal physical and emotional response to both the pain in his shoulder and the fright of the fall itself.
Hearing that he is stable definitely gives me some relief. Thank you. What exactly is going to happen with him now?
It is entirely understandable that you want to know what to expect, Mihiraa, and I am here to guide you through each step so you both feel supported. Right now in triage, our immediate focus is making sure he is safe and comfortable. We will start by gently checking his vital signs and doing a brief initial physical check to assess his injury. Crucially, we will get him some appropriate pain relief right away so he does not have to sit in discomfort. Once he is settled, you will both head back to the waiting area briefly while we prepare his room. After triage, a doctor will see him for a detailed physical examination to evaluate his shoulder closely. To get a complete picture and rule out any broken bones, the doctor will likely order an X-ray. From there, we will put a clear treatment plan into action, which often includes placing his arm in a supportive sling to keep it immobilized and comfortable while it heals. We are going to take good care of him every step of the way.
That sounds like a clear plan. How long do you think we will have to wait out there before the doctor can see him?
I completely appreciate why you are asking, Mihiraa, as waiting with an injured child can feel so stressful and long. I wish I could give you a specific time frame, but our waiting times depend entirely on clinical priority and the availability of our doctors as urgent cases come in. Please rest assured that Rooney will be continuously and closely monitored by our team while you are in the waiting area, and we will act immediately if anything changes. His comfort and safety remain our priority. Before you head back out, I want to pause and ask if you have any questions or specific concerns on your mind right now that I can help address for you.
No, I understand that urgent cases come first. My main concern was making sure his arm gets properly examined, and you have explained that clearly.
Thank you for your understanding, Mihiraa, and I am glad that explanation brought you some peace of mind. Now that we have discussed the care process, I would like to establish your consent for us to perform the initial clinical checks. May I have your permission to take Rooney's vital signs, such as checking his temperature, heart rate, and oxygen levels, so we can ensure he is stable and comfortable?
Yes, absolutely. You have my full consent to take his vital signs and do whatever is necessary to help him feel better.
Thank you so much for your consent and cooperation, Mihiraa, as it allows us to give Rooney the best possible care right away. To ensure that everything is completely clear before we proceed to take his measurements, I would like to summarize our entire discussion today. In summary, we have recorded the details of Rooney's fall, reassured you that he is stable and that his crying is a normal reaction to pain and shock, outlined the next steps involving vital signs, pain relief, waiting area monitoring, and the doctor's upcoming examination with potential X-rays, and secured your full consent to perform his vital checks right now.